Welcome to Have More Babies, and thanks for tuning in. Today, we're diving into something pretty important, maybe seems a bit distant, but honestly, for families, especially if you're thinking about international travel, it's yellow fever. We've got this great guide from Omega Pediatrics, really detailed stuff. And our mission, well, it's to unpack that, give you the key nuggets, the actionable knowledge, basically a shortcut, so you feel confident about your child's health, even if you're heading somewhere new. So, okay, let's pull back the curtain here. Yellow fever. We've maybe heard the name, sounds a bit historical, maybe exotic, but what exactly is it? And why is it still a thing families need to think about today, especially with travel?
Right, that's the core question. And it's good to get past just the name. Yellow fever is it's a viral disease
Yeah.
caused by a virus, which means, antibiotics aren't going to touch it. It gets passed to people mainly through mosquito bites. Infected mosquitoes, specifically the Aedes types. And the Aedes aegypti mosquito, that was really something because it loves urban areas, lives near people.
Oh, wow. So not just out in the jungle somewhere.
Exactly. It could be a risk right in the city. That's a key point. And the yellow part, that comes from jaundice, the yellowing skin and eyes that can happen in severe cases. And here's something interesting, a real sort of deep dive fact. The vaccine for yellow fever, it's one of the oldest, most successful ones ever. The guy who developed it, Max Theiler, even won a Nobel Prize for it. Shows you how effective it's been for so long.
That is interesting, especially the urban link and the vaccine history. Okay, so the Aedes mosquito is the carrier. That helps focus things, doesn't it? If families are planning travel, maybe even volunteer trips, where should they be most aware? Where's the biggest geographical risk?
Yeah, the Omega Pediatrics material is pretty specific here. It points to two main zones. First, there's sub-Saharan Africa, especially West Africa. Think Nigeria, Senegal, Ghana. Those are mentioned as hotbeds. It's the climate, you see. Warm, humid, perfect for those mosquitoes, plus lots of people, which helps transmission.
Okay, sub-Saharan Africa. Got it.
And second, parts of South America. Countries like Brazil, Colombia, often near the Amazon basin, that's where the mosquitoes and human activity kind of overlap. So it's really, really important if you're considering travel there. Check the official travel advisories. They change, and vaccination proof is often mandatory just to get in. You don't want to ignore that.
Right, mandatory entry requirements. That's serious. Understanding the where is step one. But then, for a parent, the big question is, what does it look like? If a child gets sick, especially somewhere unfamiliar, what are the signs? This is where it gets really practical, understanding the symptoms.
Absolutely. And the symptoms, they can vary a lot, from really mild, like the flu, to, well, unfortunately, life-threatening. The source points out some key things to watch for. Often it starts suddenly. A high fever, maybe chills come with it. Muscle pain is another big one, especially in the back and legs. Can be quite bad.
Okay, fever, chills, muscle pain.
Right. Headaches, nausea too. Pretty common. But here's the really critical thing parents need to know. Sometimes, after these first few days, the child might seem to get better, like a brief recovery.
Oh, a remission.
Exactly. But it can be deceptive because for a small percentage of people, after that brief improvement, it can shift into what's called the toxic phase. And that's when the really severe stuff happens. The jaundice we mentioned, bleeding from the eyes, nose, mouth, and organ failure. Kidneys, liver. It can happen fast, and it's extremely dangerous.
Wow, that toxic phase, that's definitely something parents need to have on their radar. Really highlights why you need to be watchful. So if those symptoms pop up, especially after travel to a risk zone, how do doctors figure out if it is yellow fever? How's it diagnosed?
Yeah, if those symptoms show up, and there's that travel history, doctors move quickly. Diagnosis is usually a mix of things. First, blood tests. They look for the virus itself or the antibodies your body makes to fight it. And your travel history is absolutely crucial. Did you recently visit an endemic area that's, a place where the virus is known to circulate regularly?
Knowing where you've been tells them what to look for.
Precisely. Instead of just thinking it's a cold or something else. So they combine that detailed travel info with the clinical signs they're seeing to confirm it. And it really underscores, doesn't it, how vital it is for parents to give that accurate, complete travel history. It's key for getting the right diagnosis fast. Missteps there can delay vital care.
Hearing there's no specific cure, that sounds really serious, a scary thought for any parent. So what can doctors do if a child is diagnosed? And, maybe more importantly, what's the best way to prevent it in the first place?
You're right. Knowing there isn't a direct antiviral cure can be, well, daunting. Since it's viral, treatment is all about supportive care, managing the symptoms, helping the body fight. That means things like making sure the child stays really well hydrated. Fever can dehydrate you quickly. Using pain relievers like acetaminophen to manage the fever and aches. Make them more comfortable. And in severe cases, definitely hospitalization. For close monitoring, IV fluids, maybe even support for organs if things get complicated. The whole goal is just keeping the patient stable while their own immune system does the work. But connecting this back, like you said, prevention is absolutely paramount. And we have a fantastic tool for that, the yellow fever vaccine. It's incredibly effective.
How effective are we talking?
We're talking robust immunity, lasts at least 10 years, often much, much longer. For most people, a single shot likely gives lifelong protection. And, like we mentioned, for some countries, it's not optional. It's required for entry. You need that certificate. Plus, kids can get it starting at 9 months old, so you can get that protection early for young travelers.
That's really good to hear. An effective vaccine available early, that offers a lot of peace of mind. But okay, besides the vaccine, what else can families do to kind of build up that defense against yellow fever, especially with kids traveling? What does this mean for you as a parent trying to create that shield for your child?
Right, it's always best to have multiple layers of defense. Think of it like that. The source mentions community awareness, everyone kind of knowing the risks. Education helps everyone make better choices. And then basic mosquito bite prevention is still super important. The vaccine protects against yellow fever, but not other things mosquitoes carry.
Good point. So things like repellent.
Exactly.
Yeah.
Using insect repellent, the right kind for kids, applied correctly. Things with DAT, picaridin, oil of lemon eucalyptus usually work well, following age guidelines, of course. Also, wearing long sleeves and pants, particularly around dawn and dusk when those mosquitoes are most active, just adds a physical barrier. And it's also about working with your doctor. They can help create a plan based on your child's health, their shot record, and where exactly you're going. That open communication, talking about risks and plans with your healthcare provider, that's key for a tailored approach.
Yeah, protecting kids' health isn't really a one and done thing, is it? The world keeps changing, health advice evolves. How can parents stay on top of things, stay informed and prepared? It feels like constant vigilance sometimes.
It really is an ongoing commitment, Stella. It's a journey of learning. Having accessible resources is so important. Things like trusted medical websites, maybe newsletters from places like Omega Pediatrics, online platforms that can keep you updated on advisories, maybe new risks that pop up, things like pediatric health workshops too, online or in person. They can really build your knowledge base, let you talk to experts, because ultimately parents who are informed, they're empowered. They can advocate better for their kids. It's all about being proactive, having current info ready, not waiting until there's a problem.
It really does feel like knowledge transforms the situation, doesn't it? Something like yellow fever goes from this big, scary threat to, well, a manageable journey if you're prepared. It's about feeling confident, resilient, keeping your child's health front and center no matter where you go. And it does make you pause and think, how lucky we are to have effective vaccines, readily available information, things that aren't given everywhere, puts our choices in perspective. So if you want more detailed resources or maybe personalized advice on the yellow fever vaccine, or just want to look into pediatric services for your family, we definitely encourage you to visit omegapediatrics.com. That's OMEGAPEDIATRICS.com. You can find expert advice and support there. And hey, if you found this conversation valuable, please do take a second to like this video, subscribe to the channel too for more insights like this, and maybe share it. Share it with other parents who might find it useful. Okay, that wraps up our look at yellow fever and child wellness today. We really hope this gave you some clear, practical takeaways to help protect your little ones. Thanks so much for joining us on Have More Babies.
Yeah, stay informed, everyone. Stay proactive. And keep your family's health top of mind wherever your adventures lead.
Until next time, take care, and we'll talk soon.